When our son was diagnosed with stage 4 cancer, we wanted to know everything science and experience has proven effective. What we found was a lot more than we were shown at the hospital. With so many highly educated, seasoned professionals operating outside the bounds of conventional medicine, it just didn't make sense to limit ourselves when the stakes were that high. This approach paid off, and now we're bringing the information to you. Wisdom from the top integrative and holistic cancer doctors and healers around the world, all in one place. Because you deserve true answers to cancer. It's time for a revolution against one-size-fits-all medicine, a revolution that takes us back around to the old ways of healing and forward to the new. That revolution starts right here. When it comes to reversing or preventing cancer, this is where you come for the best of the best. I'm Ryan Sternagel of the Stern Method, and this is the Anti-Cancer Revolution. Hey there, it's Ryan, and this episode is highlights from our Going Integrative Plus community calls, where real people get to ask the top holistic cancer doctors in the world anything they want, each and every week. Stick around at the end to find out how to be on these calls, asking the questions yourself, but in the meantime, enjoy and take something you can use right now from the show. For anyone who does not know, Jane is a natural, revolutionary, powerful speaker and a brave, passionate advocate of fellow cancer sufferers. She worked in the NHS and private practice for 12 years, specializing in neurology and then orthopedics when she left the profession to pursue more entrepreneurial endeavors. Throughout this time, 1994 to 2004, Jane battled 2 aggressive cancers with metastatic spread. Both were classified as terminal. Using her medical knowledge and researching heavily, she put together a cancer-starving formula using natural therapies, exercise, and diet. When she developed a second cancer, leukemia, the result of chemotherapy and radiotherapy from her first cancer, she knew she only had weeks to live with nothing to lose. She put together a unique cocktail of old drugs. To her enormous relief, joy, and surprise, her cancer just melted away. Her cocktail was more powerful than she'd ever hoped. Jane spends much of her day coordinating cancer care for patients, researching off-label drugs, and providing up-to-date information for her thousands of followers in her Facebook group. Her mission to turn the oncology profession upside down. Yeah, and Jane, you came on I think that was our first Anti-Cancer Revolution event we ever did, and that was like not too long after the first version of your book came out.
That's right.
And we met we met at the
Annie Appleseed
conference in Florida. And great conference for anybody who likes actually getting in person and talking to fellow, kind of like this membership here. We get to talk to each other each and every week, but, face to face, maybe someday we'll do a Going Integrative meetup conference in person.
Annie Appleseed next year. It was such a shame it was postponed again this year. It's really looking forward. Every February is kind of like my excuse to go and get my vitamin D in Florida. Weather here in London is rubbish. So... it's I really enjoy the conferences and stuff, and it's ironic, kind of not too long after we went full-time online and I was like, okay, now I'm really going to get to go to all the conferences. That's when COVID happened, and nothing, there was no conferences. Now they're starting to trickle back, but good stuff. Well, Jane, we've grown in our mission. You've grown in your mission. It's just, it's really cool to come back together with you a few years later and reconnect. I am going to, I'm not going to spend too much more longer shooting the breeze because we got a late start. But first and foremost, Jane, what is anything else you want to say about yourself, your journey, things that people that are going to ask you a bunch of questions should know about? And then to kick us off, kind of go anything, just, latest and greatest that what are you geeking out on? What are you, spending all of your time researching and talking about right now when it comes to cancer? Okay. Well, my big topic at the moment is ferroptosis, which is, probably people don't know what that is. I wrote about it in my second edition of my book. And this is a different way to cause cancer cell death. Apoptosis is one way that the oncologists are kind of very familiar with. Unfortunately, when you have stage 4 disease, cancer becomes resistant to apoptosis. And ferroptosis seems to be a very good route for cancers that are resistant. So you have a lot of the KRAS
cancers, which are resistant to an awful lot of stuff, things like mesotheliomas and really tricky cancers like rhabdomyosarcoma, the slightly odd ones, but can be really aggressive. And they actually tend to respond the best because they have this avid desire for iron. So pancreatic cancer, triple negative breast cancer, they actually do respond very well to ferroptosis. But it's just a matter of getting the right cocktail, getting it in place in the right way. And I have seen some stunning results using ferroptosis with people. Just, they don't have to do the full program. I'm trying to coordinate maybe some clinics with an oncologist in Egypt, and we're hoping one day we'll try and get a clinic in the UK. We may have a clinic in some other places as well, but we're working on that. But that would be awesome, because that would really give people another option to treat these really tricky cancers. Pancreatic is just like that's the worst, really. GBM also responds, actually. You have to be a bit tricky. It's a little dicey with that one, because you can cause a little bit of brain damage if you're not careful. But if you take beta hydroxybutyrate, you protect the neurons at the same time. So you absolutely must take that at the time of doing ferroptosis. In fact, that'll protect you, whatever cancer you have. The beta hydroxybutyrate will actually help, and that's a ketone, and that you can take exogenously. So you can take the actual supplement, or you can do a ketogenic diet to try and stimulate the release of natural beta hydroxybutyrate. Did I lose you?
No, it's all good. And when you say you're getting some clinics to work on offering it, what's the difference between, you mentioned natural, natural compounds, off-label drugs, that sort of thing to stimulate ferroptosis. What's the difference between what you can do at home and what a clinic would be able to help out with?
Intravenous vitamin C is kind of like the trigger, because that'll produce a hydrogen peroxide that'll oxidize the iron inside the cell and cause the cell to damage the cell membrane. And that's what it does. And it only does that in the cancer cell. If you do it properly, you don't affect the healthy cells, you just affect the cancer. And that's, it's a targeted drug, along with, and if you use sulfasalazine, which is an old arthritis drug, that actually has a really good effect at blocking the uptake of cysteine. And cysteine, you probably heard of N-acetylcysteine. It produces glutathione. Actually, you want to knock back the amount of glutathione, which is your master antioxidant in your cell, in order to promote free radicals in the cell. So it's a very pro-oxidant kill phase approach. That's what I do. The star phase is much more antioxidant. You can put a ton of antioxidants in there, but if you're doing a kill phase, you really need to go pro-oxidant. It doesn't have to be particularly long. You can do it for 2 or 3 days, or even 1 or 2 days, or even just do 1 day of intravenous vitamin C with this program, maybe once a week. But the thing is, you make intravenous vitamin C that much more effective. It isn't particularly effective unless you use it with the right cocktail. So a lot of people fail with their intravenous vitamin C because they're not adding the right things together with it.
Yep. Yeah, that has been a recurring theme lately, is kind of balancing your antioxidants and your pro-oxidants.
Yeah.
And not mixing the two. And it's funny because that's been like the conventional oncologists are scared to death of antioxidants in combination with chemo. For some reason, I mean, the bulk of, you want to be careful with NAC and a couple of them, but I mean, a lot of like the vitamins and food-based compounds and stuff like that the research does not really support that concern. But yeah, when you're talking about natural stuff, ironically, or even, kind of your off-label approach, that sort of thing, it is a good idea to not mix up your pro-oxidants and your antioxidants.
Chemo is a little different in that it will actually damage your healthy cells much more.
This is
so
true.
I think you do need a certain level of antioxidants in your protocol in order. Yeah. Whereas if you're using intravenous vitamin C, that's more targeted towards your cancer cells. And I think you need to really focus on the pro-oxidant effect with that. But actually chemo, I do think that there is definite benefits to adding some of those antioxidants in. That most of the polyphenols are actually, they have cancer starving effects. So that's why they work beyond their antioxidant capacity. So curcumin, for example, starves cancer. Artemisinin obviously starves cancer, but quercetin starves cancer. All of these alpha lipoic acid starves cancer. They all work on either glycolytic enzymes or the glucose receptors, or all of those pathways I mentioned in my my Metro map. That they actually starve the cancer, and that's why they make it much more effective. It's a bit like a form of fasting, but you don't, you're actually doing it with supplements to assist that. And that's why you see fasting being so much more effective with chemo, because it's actually starving the cancer cell, and the supplements can assist that too.
Joey was asking, what strength of vitamin C do you recommend? And I guess, that answer can be all over the map, but any particular guidelines when
the Reardon Clinic, who are kind of like the top guys in this, they say between 1 gram to 1.5 grams per kilo of body weight. So if you're a 60 kilo woman, 60 grams, or a little bit more, up to about 75 would probably be fine. So some people actually measure the amount of vitamin C that gets into the system, but it can be a little bit dodgy to sort of measure that accurately. So general rule is about 1 to 1.5 grams per kilo. Can
you outline the kill phase with drugs that will be available by my practitioner? And that's, Jane, people have, I was joking before you got on that no matter what guest we have on, somebody inevitably asks about Jane McLelland and how to starve cancer. But that's one of the things that comes up, right? Is not everybody's practitioner is willing to go prescribe this, cocktail of random drugs just because they read about it in this book called How to Starve Cancer. So yeah, I mean, I guess Peter's question was, I was kind of adding on to Peter's question, but Peter's question was, can you outline the kill phase with drugs that will be available by my practitioner? But then I'd love to hear your thoughts on just, how to get your hands on everything you're trying to get your hands on when following your approach.
Yeah, and it is tricky because, there is a lot of reluctance by the medical practitioners to actually take on these off-label drugs. They do worry about, stepping outside of the guidelines and getting their wrist slapped. And
well, even even like indies that are able to prescribe pharmaceuticals, they, a lot of them have a hard time with it too.
Yeah, and a lot of it is because they're not comfortable with it. They've not done it before. They don't really, they're not prepared to step outside the box and try something different. And frankly, if you have a stage 4 cancer patient, you want a doctor who's actually going to take maybe a little bit of a risk for you.
I always say you want to look for a cowboy.
A little bit of a maverick is what you're looking for. And I'm very lucky that I had one with Dr. Calibu. I'm very, very sad that he's now passed away. He passed away about 4 months ago. But he was the doctor that I went to and said, please, can you prescribe me dipridamol? And he went, yeah, okay. I read about that in the 1980s, never prescribed it, but yeah, okay, I'll do it, And I was very lucky that my oncologist prescribed statin and non-steroidal, a really strong non-steroidal together, because you add them together and their cancer kill increases by 5 times. So that was one of the reasons I stuck that into my ritual. But somebody's saying, please go over the drugs you feel are necessary during the kill phase. Okay. So kill phase is a pro-oxidant phase. So what you're trying to do is produce free radicals that will actually kill off the cell. It'll overwhelm the cell. So what you want to do is shut off something called the XCT antiporter. Now, this is something that pulls cysteine into the cell and produces that glutathione. So drugs that will do that: sulfasalazine, sorafenib, actually is a normal. It's used for liver cancer. So if you're on sorafenib, you're kind of almost doing it. Cisplatin will actually help block the XCT antiporter. So it's a way of actually using the cisplatin, making it work more effectively by adding some of those supplements that I mentioned earlier, the piperlongumine, sulforaphane, ashwagandha, artemisinin. You can even add intravenous vitamin C as part of your kill phase alongside chemotherapy. In fact, the Reardon Clinic add intravenous vitamin C the day after people have had their chemo, just to extend that pro-oxidant effect. And actually it works as a detox as well on the body to try and get rid of the chemo. So it has that double-edged effect, which is great. But other drugs that will work, there are drugs called Avastin. They're not generally used, but sulfasalazine is one of the biggies in this, to produce the ferroptosis.
NAC, GSH, selenium, etc., are suggested for jab and spike mitigation, but you've shown how these substances can advance cancer. Any comments on this conundrum?
Pulsing it. And if you're going to so there are times when you want to have NAC or you want to have selenium. Selenium is actually a heavy metal. People don't realize that. And your body can't deal with too much of it. It's shown to promote prostate cancer and other cancers if you take too much of it. So you want to be pulsing it. So you want to take a break every now and then. NAC, a little bit, maybe after chemo, for a few weeks, just to reboot your immune system, can be very useful. But, you have to be careful with it. I have seen people take NAC for too long. It prevents the cancer from being killed off. It promotes the resistance of the cancer to being killed off. It is a potential problem if you start taking it for too long. But yeah, a little bit every now and then is going to be fine. Same with CoQ10. People think I'm totally against CoQ10. I'm not. I just think you need to be very careful when you take it, because obviously if you are on statins and if you are getting some muscle aches and pains, that actually means it's doing its job. It's reducing. CoQ10 can actually stop that pulse of free radicals, that pro-oxidant effect that you want to get sometimes, particularly if you have a stage 3 or 4 cancer and you've got an aggressive cancer. You do want to be having a kill phase. So it's very much, what level is your cancer? How bad is it? And what you need to be doing for it is to sort of, it's always a juggle. That's the thing. There's no right or wrong protocol. Everything has to be personalized to try and fit you with your particular situation. And you need to be tested. You need to know what your immune cells are up to. You need to know your LDH and all sorts of other parameters. Your insulin levels, your fasting glucose. All of those things really should be checked, so that you have a much more you have a bigger handle on what you personally need to be doing to try. Are you needing to reduce your glucose levels a bit more? Should you be doing a lot more to try and knock that out with more berberine? Even you can add a little bit of berberine maybe to metformin. That's not generally advised by the Care Oncology, but they do work on slightly different pathways so that you can get that synergistic effect. So, and I did that. I add my berberine to my metformin every now and then. Doesn't have any bad effects on me, but everybody's different, and you need to be monitoring your glucose. You need to actually know what's actually happening to your body. I sometimes wear one of those glucose monitors on my arm. Don't do it all the time, but it is very useful as a method to just try and find out what's going on with your body. Have you ever tried it, Ryan?
I have not, but it's on the list of things that.
Yeah, have a go. You might be shocked.
On the long list of I'm going to try. This for a while, but it's on the list.
I purposely tried taking some really bad foods like my children's cereal just to see what happened, and my goodness, it was shot up. It was extraordinary. Anyway,
is there any big surprises like the things that didn't spike as much as you thought they were going to?
No, not actually. Fried foods actually made it far worse than I was expecting. So yeah, that was a surprise to me. I thought that, fried carbohydrate. Well, I was frying some sort of sweet potato type of bean. I was doing a sort of a natural burger type thing, and it really spiked my levels really quite high. So yeah.
When you say fried, you're not talking not like deep fried or something like that, but
no, just in a pan with a little bit of olive oil. Yeah.
Interesting.
Yeah.
Jane, any overall thoughts on rectal cancer?
Yes, I definitely think there are things you need to know, and you need to have it tested. You need to find out whether it's KRAS driven, MYC driven, whether you've got particular mutations, because that will mean there are certain mutations. The KRAS, for example, responds really well to intravenous vitamin C, ferroptosis, and also modified, the fasting mimicking diet, the Voltalongo one, that has a really good response. So you need to find out if it's KRAS, and that would definitely help. So you might be able to get away with something a little less aggressive, maybe, but I wouldn't, I hesitate to say that, not knowing how aggressive your cancer is. And, you might be risking your life if you don't have the surgery. And it's a very tricky one to I wouldn't want to make a call and say, yeah, do that, and sound a bit gung-ho about it, because you really need to have proper advice. But unfortunately, because the oncologist isn't going to tell you about intravenous vitamin C and KRAS, or maybe they're not testing the tumor enough to work out what it is. I mean, the MYC-driven ones tend to be more glutamine-driven, so that's a slightly trickier beast. But the KRAS, it kind of, it actually, because it's more aggressive in some ways, actually it's a bit like the triple-negative breast cancer or the pancreatic. It responds better to the ferroptosis because it's more iron-driven. So that's why, I think that's why Chris Walk did so well with his. I reckon he had a KRAS driven cancer, and he did the intravenous vitamin C and managed, even with stage 3, to get rid of his cancer. So, that's my thought, is that he had a KRAS. I don't know for sure, but I'm kind of guessing. So I think it's well worth finding out.
Yeah. Yeah.
But, it's very hard if you don't have a KRAS driven colorectal cancer and you see him having done well with it, and you think, oh, great, I'll do it. But if you're not the same mutations, or if you don't have the same, not everybody's a KRAS driven colorectal. So, you could be putting yourself at a lot of risk. It's well worth finding out. And they will have probably done a biopsy. So get that sent off and get some feedback on what's driving it, for sure.
Tried statins per the CARE protocol, but found that atorvastatin aggravated my neuropathy. Will CARE protocol work without the statins?
Ooh, well, there are natural alternatives to it, for sure. So bergamot would be an alternative. Citrus bergamot, you can get that from Jarrow, do a good one. And there are other things you can add as well. Red yeast rice would be a natural. You'd probably have to have quite a high dose of that in order to make it work. And what else? Yeah, you can make it work, but actually you're putting yourself a little bit at risk. It depends. Which cancer are we talking about? Sorry. Some cancers are more. So there are 2 cholesterol pathways that cancer uses: SREBP2 and the mevalonate pathway. So those are 2 cholesterol pathways. The mevalonate pathway is blocked by statins. The SREBP2 pathway is blocked by dipridamole, which is the drug that I took a combination of both. But luteolin, delta tocotrienol will also help block the SREBP2 pathway. So you could potentially add that instead of the dipridamole to block the alternative SREBP2 pathway. That would make the statin more sensitive. You may not need quite such a high dose of the atorvastatin. I don't know what dose he was on. Can't get any feedback on that at the moment, but let me know what dose you're on and what cancer you have, because some cancers are more, I mean, if it's prostate cancer, it really does respond quite well to statins. But if you go on a low dose of statins, say 10 milligrams, you can actually cause progression. You actually want to have probably a 40 milligram minimum dose of a statin, and probably add aspirin to that as well. I have seen aspirin and statin work really well. But again, if you can't take that level of statin, you can increase the efficacy with bergamot. And maybe if you're getting neuropathy, try alpha lipoic acid to try and reduce the neuropathy. Maybe pulse, maybe a bit of CoQ10, but don't take it all the time. But just pulse a little bit every now and then.
Here's a good question: what supplements does Jane take on a regular basis?
Fish oils, for sure. I take glucosamine sulfate still, and actually that has an effect on blocking glycolysis. I didn't realize that until relatively recently, but I kind of have always taken it for my dodgy knees, skiing damaged knees, but it actually has an effect on blocking glycolysis. It also has general effects at sort of increasing your longevity. Metformin on and off, berberine on and off, quercetin, vitamin D. I also take indole 3-carbinol. At night, I take melatonin. I still occasionally take a statin and dipridamol. I pulse that. I don't take a statin all the time, but I will take it every now and then just to give my body a quick boot. And then supplements. What other supplements I take? Oh gosh, there's quite a lot. Magnesium and quercetin, and sometimes I'll take fermented wheat germ extract. Quite a lot of stuff when I think about it.
Especially when you're concerned with just trying to have a general cancer rotation. It's you just kind of throw in. It's been a while since I did the wheat germ extract. Let's tag it on for this month.
Exactly. And I'm not. I was very dedicated every day, taking a huge bunch of stuff for many years. I'm getting slacker and slacker as we get further away from my diagnosis. So I'm putting myself at risk. But
I don't know if anyone. Yeah, well, I mean that's also the point too. You can't always be in patient mentality for the rest of your life.
Exactly.
I think that starts to do more harm than good at some point.
Yeah.
And especially to your bank account as well, right? It's
exactly.
If we were on the 50 different things that we were for our son at any given time, that was hard enough to sustain for many years, let alone a lifetime. So
exactly.
Sounds like you're doing good. How much melatonin for cancer / prevention? This is always an interest. Do you have any? Have you geeked out on melatonin dosing lately, Jane?
I still take 10 milligrams at night. Sometimes I'll take 20, but 10 generally for myself. But is that enough for prevention? I don't know. I think it depends on. Certain cancers are more glycolytic, and we know that melatonin blocks some of those glycolytic pathways. So, and also actually recent research showed that actually metastatic spread happens more at night, believe it or not, than it does during the day. So the metastatic cancer cells are more active. And actually, if you were to do circulating tumor cell a quick blood draw, you actually have a higher number at night than you do during the day. So if you've had cancer, you're trying to prevent it coming back, definitely, I would say probably 20. But if you haven't had cancer, if it's just purely for prevention, I'm guessing everybody on your site has probably had it or going through it. So I'd just probably say 20 milligrams is the general accepted level. Some people do go up to 60, and some people even, will actually say that you should take melatonin all through the day as well, because it's blocking that glycolytic enzyme. So that, some people do very well on that. Actually, I've seen, in fact, colorectal cancers do very well on high dose melatonin during the day as well.
Hello, Jane. I love your book. I have stage 4 ALK plus lung cancer, non-smoker. I am unsure of what side of the metro map to be focusing on. Any repurposed drugs in particular I should focus on? Is this cancer due to dirty estrogen from hormones or from plastics in the environment?
Okay. Actually, I've kind of broken down all the mutations. So you get very specific mutations with non-small cell lung cancer. And I devoted my last module in my online course. And if people haven't seen my online course, they should definitely have a look at that, particularly if they've struggled with the book and they haven't quite made sense of it. My online course is there to help guide you much more, hold your hand with it. And in the last module, I talk about non-small cell lung cancer specifically with the mutations that you get and what actually are the drivers of those things. And offhand, I cannot remember what that drives specifically. I could probably look into my notes, but I haven't got them right here. But certain, it will drive certain changes. So any mutations that you have will drive things like glutaminolysis or glycolysis or particular pathways. It will drive. So definitely do my online course, get to the last module, and focus on that, because I do go into the details of the actual mutational drivers and what they will specifically change. So it's important. And in fact, those things like the P53, for example, will change your glutaminolysis and your glycolysis. So that's really important to look at. It'll also increase the cysteine uptake in the cell and produce that sort of resistance that you get against chemo and radiotherapy. And that's where your ferroptosis and blocking that would be useful. So it does depend on the type of mutations you have as to the metabolic changes that you have as well. Look at my course is what I would say with that, because it really is very useful for that.
I was diagnosed with triple negative breast cancer 10 months ago due to other health problems. I have been told that I am not a candidate for surgical option or chemo. And I've been told that radiation would cause lung and heart damage. So she's all natural. Even the medical doctors are telling her they can't do her stuff. I have been on a plant-based diet with small amounts of fruit and fat and lots of vegetable juices and supplements. My question is, what are the best plant-based proteins to eat? I know methionine and glutamate are in beans and lentils, but much less than meats and fish. But that is what I have been eating, plus the vegetable and seed proteins. But I know methionine, sugar, and glutamine all feed this type of cancer. My cancer is aggressive, but so far it is on one breast. I have lost 56 pounds on this eating plan, and my health is better. So yeah, I guess all of that said, to sum it up, what are your thoughts on methionine and glutamine/glutamate when it comes to cancer? And then, any thoughts on her, just overall dietary questions there, Jane?
Okay. So the methionine free diet really works well in combination with the ferroptosis. And that's kind of when I suggest doing that diet specifically. And triple negative is one of those cancers that does respond, which is why the methionine-free diet is kind of, it all fits into place when you look at sort of what works for a particular cancer. And yes, ferroptosis does definitely work for triple negative. So definitely look into the ferroptosis and the methionine-free. It's hard to do that all the time. And I definitely think if she's unable to do any of those other protocols, definitely look into the ferroptosis. Who can I suggest you go and see? Dr. Will LaValle is, he's one of the guys I speak to him regularly, and we're very much on the same page with the ferroptosis.
Very similar work.
And, yeah. And he would help you with that. I don't think it's particularly cheap, but he would be a really good doctor to speak to. Otherwise, travel to Egypt and try and see Dr. Ahmed El Saka, who's, really up with the Ferroptosis protocol and somebody who I want to create a clinic with. So I don't know whether he would see you. I think it's quite hard to see patients outside of Egypt or, from overseas. But worth a try, I guess. But Dr. Will LaValle would probably be my first thought for trying to get to try and get treatment for that.
Do you have an opinion about how often to do IVC when cancer is not apparently growing?
Yeah, a lot of practitioners will sort of wean you down to sort of once every fortnight, and then they'll wean you down to once a month for 6 months. And that may be enough. And then you just do it once every 3 months. It really depends on the type of cancer. If you've had a really aggressive cancer, yeah, I would maybe look at doing it sort of once a fortnight, even if you're in remission for a while. And that can be very expensive, but just it's something that everybody's going to be slightly different with. But again, try and make that intravenous fitted, really make it work. So, the Ferroptosis protocol alongside the intravenous vitamin C will make it that much more effective. So you don't necessarily need to do it as often. If you can make it, get rid of those cancer stem cells much more effectively, you don't need it as often.
Really glad to get you on. Would you like to remind everyone where to find you, your book, your course?
If you haven't got my book, get my book. If you're a bit worried about the overwhelm with information in my book, my first edition I've actually relaunched. It should be available back out in the US, but we seem to have had they seem to have gone somewhere between the UK and traveling to the US. They're somewhere in customs, I think. But hopefully, if people want the first edition, it's easier read because it's not quite such a weighty book. It's 80 pages less. But the second edition has got all that ferroptosis info. It's got more, it's more in there. And that I cover all of that in the online course, obviously. And I think it's important to sort of, read the book, do the online course, go back to the book afterwards. It's sort of going to compound what you know. And every time you go through it, you'll go, oh, and, it's like learning a foreign language. It'll all seem really weird and unfamiliar when you first look at it. What the hell's mTOR? What the hell's mevalonate pathway? But once you get into it and you go, oh, okay, that's the cholesterol pathway. Oh, that's a protein sensing thing that will just stimulate cancer. So you just gradually accumulate the knowledge and you don't get so overwhelmed or scared by these strange, unfamiliar words because you learn. It's just a learning process. So my website's kind of got most of the links for everything. So howtostarvecancer.com is where you'll find links for getting the book. You can get it on Amazon as well. Good to see you again, Ryan.
Very
and
good
hopefully catch up with you at some conference somewhere.
And again, this episode was highlights from one of our Going Integrative Plus Q&A calls, where we get a top holistic cancer doctor on a call once a week, and our members get to ask whatever it is they're currently trying to figure out. If you would like to hear the rest of the 2-hour call, along with over 100 other calls we've done, along with the recordings, notes, and slides from our entire first and second Anti-Cancer Revolution online conference events, and most importantly, the ability to ask the doctors and healers featured on our events and community calls anything you want yourself directly. That's what you get with Going Integrative Plus. This is the resource and community my wife and I would have given anything for when we were going through cancer with our son. Each and every week, we get one of the top holistic and integrative cancer doctors on a call, and you get to ask them anything you want yourself. Listening to this podcast for your health is amazing, but getting to be the one asking the questions yourself about whatever you're currently trying to figure out dramatically shortcuts the learning curve and helps you make more right decisions faster and avoid the wrong ones. Again, you also get every past call we've ever done, which is hundreds of hours of content that's all transcribed, timestamped, and searchable, so you can see what all of our experts have said about any particular topic, which is a very nice antidote to how hard it's become to find good natural health information pertaining to cancer online these days. Huge discounts on all of our favorite supplements and devices, and maybe most importantly, a great community of people who are all on the same page with holistic healing. It is the absolute most valuable thing for someone serious about either preventing or reversing cancer we could imagine, which is why we made it. You can check it all out and become a part of it at goingintegrativeplus.com if you feel like this would be a helpful thing for you. And always remember, if you are going through cancer or anything else you'd rather not be, just keep going. God bless and Godspeed, and we'll see you on the next one.